apex, crown, side, soft tissue, recurrent. That single sequence solves most NEET MCQs. Odontogenic cysts, let's make it easier for you. First, divide them into two big groups: inflammatory, radicular, residual and paradental; developmental, dentigerous, eruption cyst, odontogenic keratocyst, lateral periodontal cyst, gingival cyst, calcifying odontogenic cyst, glandular odontogenic cyst. Easy memory: irritated cyst, inflammatory, growing cyst, developmental. The master MCQ algorithm asks 5 questions in this order. First, is it at the apex of a non-vital tooth? Radicular cyst. Next, is it around the crown of an unerupted tooth at the CEJ? Dentigerous cyst. Is it on the side of the root of a vital tooth? Lateral periodontal cyst. Is it in the soft tissue over an erupting tooth? Eruption cyst. Is it in the posterior mandible, grows anteroposteriorly, recurs and looks aggressive? Odontogenic keratocyst. That algorithm alone will solve a huge number of questions. Next, the high yield one-liner every student must know. Radicular cyst. Most common odontogenic cyst overall, associated with non-vital teeth, located at the apex, arises from the rest of the mollasses. Memory: radicular is equal to root dead cyst. Residual cyst. Basically a radicular cyst left behind after extraction. Memory: residual is equal to radicular remains. Dentigerous cyst. Most common developmental odontogenic cyst around the crown of an unerupted or an impacted tooth. Attached at the CEJ, common with mandibular third molars and maxillary canines. Memory: dentigerous is equal to tooth in crown cyst or crown cyst at the CEJ, dentigerous. Eruption cyst. Soft tissue counterpart of the dentigerous cyst. Over erupting tooth. Bluish swelling in the mucosa. Memory: eruption cyst is equal to dentigerous outside the bone. Odontogenic keratocyst. Usually in the posterior mandible or the ramus, tends to expand anteroposteriorly. Less expansion early. High recurrence. Thin lining. Parakeratinized corrugated epithelium. Palisaded basal cells, may have daughter or satellite cysts. Memory: OKC, the recurrence king, or keratocyst creeps quietly and comes back. This is one of the most important lines in the whole topic. Lateral periodontal cyst on the lateral root surface of a vital tooth, usually mandibular canine or the premolar region. Small, well-defined radiolucency. Memory: lateral plus vital tooth is equal to lateral periodontal cyst. Paradental cyst. Inflammatory cyst, usually around the partially erupted mandibular molar, associated with pericoronitis. Memory: pain around the partially erupted molar is paradental. Gingival cyst of the adult. Soft tissue lesion, usually mandibular canine or the premolar area. Small bluish nodule. Memory: gingiva only, no bone. Gingival cyst. Gingival cyst of the newborn. Small keratinized filled cyst in the newborn alveolar ridges, also called dental lamina cyst. Memory: newborn pearls is equal to gingival cyst. Calcifying odontogenic cyst, famous for ghost cells, may show calcification, can be mixed, radiolucent or radio-opaque. Memory: ghost cells is equal to calcifying odontogenic cyst. This is a classic direct MCQ. Glandular odontogenic cyst, rare, can be aggressive, often anterior mandible, can cross the midline. Histology shows gland-like features. Memory: glandular is equal to gland-like jaw cyst. The most important exam superlative. Students must lock these. Most common odontogenic cyst, radicular cyst. Most common developmental odontogenic cyst, dentigerous cyst. Highest recurrence and the most aggressive behavior, odontogenic keratocyst. Ghost cells seen in calcifying odontogenic cyst. Around the crown at the DEJ, dentigerous cyst. At the apex of the non-vital tooth, radicular cyst. On side of the root of the vital tooth, lateral periodontal cyst. Soft tissue over the erupting tooth, eruption cyst. Best differentiation trick, vital versus non-vital, very high yielding. Non-vital tooth, think radicular cyst. Vital tooth, think lateral periodontal cyst. Sometimes other developmental regions depending on the site. Memory, dead tooth apex, radicular. Vital tooth side, lateral periodontal. Best differentiation trick, apex versus crown versus side. Apex radicular, crown of the impacted tooth dentigerous, side of the root lateral periodontal. Memory, apex root, crown dentigerous, side lateral. This is probably the best quick triad for the exams. Next, histology cheat codes. These help in image-based or descriptive MCQs. Radicular cyst, non-keratinized lining, inflammatory infiltrate, may show rust in bodies. Memory, inflamed dead tooth lining. Dentigerous cyst, thin non-keratinized epithelial lining around the crown, CEJ attachment. Memory, thin lining hugging the crown. OKC, parakeratinized corrugated epithelium, palisaded basal layer, satellite cyst, uniform epithelial thickness. Memory, parakeratin plus palisading, OKC. Calcifying odontogenic cyst, ghost cells, calcification. Memory, ghost is equal to calcifying. Glandular odontogenic cyst, gland-like or duct-like spaces, hobnail cells. Memory, gland spaces is equal to glandular cyst. The top 5 exam traps. Trap number 1, calling every cyst around an unerupted tooth OKC. Fix, if attached at the CEJ around the crown, dentigerous. Trap number 2, forgetting the most common overall. Fix, radicular is the most common overall. Trap number 3, forgetting the most common developmental. Fix, dentigerous is the most common developmental. Trap number 4, confusing OKC with ordinary harmless cyst. Fix, OKC recurrence plus posterior mandible plus keratin lining. Trap number 5, missing ghost cells. Fix, ghost cells is equal to calcifying odontogenic cyst. The best mnemonic pack, apex crown side soft tissue recurrent, apex radicular, crown dentigerous, side lateral periodontal, soft tissue over the erupting tooth eruption cyst, recurrent posterior mandibular cyst OKC, highest yield algorithm. Classification mnemonic, inflammatory RRP, residual, radicular, paradental. Development, dual GCG is ugly, so don't mug it. Instead, remember the clinically useful ones. Dentigerous, eruption, OKC, lateral periodontal, gingival, calcifying and glandular. The best oral chant for my dear friends. Say this daily. Radicular is the most common overall and is the apex of the non-vital tooth. Residual is the leftover radicular cyst after extraction. Dentigerous is the most common developmental cyst and surrounds the crown at the CEJ. Eruption cyst is the soft tissue counterpart of the dentigerous cyst. OKC is the recurrence king in the posterior mandible with parakeratinized palisaded lining. Lateral periodontal cyst is on the side of the root of the vital tooth. Ghost cells means calcifying odontogenic cyst. If a student can say this without looking, the chapter becomes a lot easier. Hope that helps. Don't forget to save it. Don't forget to share it. Let everyone benefit. Take care.